Hello and welcome. I am Jenny Q. I am the host today. We're here today with Joe Knows Brains. Joe Lamb, attorney. Thank you for joining me.
Hey, nice to be here. Thanks for having me, Jenny.
Yeah, I'm excited to talk about the symptoms of concussions because last week we spoke on, the myths, right, of brain injuries. And some people who have injuries or blunt force trauma or whatever happens, accidents, they don't even know they have a concussion. So we're going to talk about some of the symptoms that people may not be able to recognize.
Absolutely. And I'm really looking forward to this too. We have clients call into our office all the time with no idea that they've even suffered a brain injury. And then we start asking them some of the questions related to these, and they check so many boxes that we go, well, gosh, how did you not even notice?
Yeah. Yeah. And I get it. Like I shared last week, I had a closed head injury. I didn't know that I had a lot of these symptoms. So I'm excited to hear what you say. And what's cool is they're broken down into 4 categories. So that's simple.
Oh, absolutely. It makes it a lot easier just to look into it.
Okay, so let's go ahead and start with physical symptoms. What would somebody notice physically in their body if they have a concussion?
Absolutely. And when we talk about physical symptoms, when we're talking about the things that are a little bit more objectifiable, this is often like nausea, vomiting, things along those lines, which is really a sign of dizziness, but it's so hard to show something like dizziness. More symptoms include like a blurry or double vision. Vertigo is a very common one. And for many people who don't know what vertigo is, that's when it kind of feels like the room's spinning around them the whole time. Another common one that I'll talk a little bit more about when we talk about sleep symptoms is just the general feeling of lethargy and being tired all the time. And some other ones include, just being tired, like I just mentioned, or hearing problems, changing any of the senses really, and changing any drives, such as like sexual desire, things like that. These are all things that are quite common in people who have suffered concussions, and they're what we consider the physical symptoms. They're the most objectifiable.
And so when people call your office and you're doing an intake with them, and you're asking these questions, what has been the most common thing? Like they have these symptoms, they probably notice they have them. They're just not attributing it to the concussion or a head injury. Well, are they just thinking like maybe with the nausea, they're just sick, or maybe it was something they ate? Like what are they doing with that information?
Absolutely. It's so shocking because I would say nausea is both one of the more common ones that we see and one of the more common disassociated from a brain injury symptoms that we see. Because so often they think, oh, well, I was just in an accident. It's from, they almost just want to say from the trauma. And then you describe it to them and say, well, the trauma is the brain injury that you're suffering from. And I don't want to get anyone all terrified because, oh, I'm a little bit nauseous after an accident. Because what I will say quickly is about 80 to 90% of these, they clear up in a matter of weeks to months. So just want to give a little bit of positive news there as well.
Okay, perfect. Now, I like how the next category could kind of play into why people aren't noticing the physical symptoms. So the next category is cognitive symptoms.
Absolutely. And the thing about the cognitive symptoms is where being nauseous or dizzy, it's pretty quickly noticed by an individual who's suffered an injury like this. These cognitive issues, there's something that people tend not to notice, and it's something that's real personal to me, having kind of suffered a head injury when I was a teenager and seeing some of the long-term symptoms within myself. There's small changes that are very often missed. These include excessive changes in your ability to remember or concentrate. It's very hard to quantify something like that, but it's something that each individual, when they try to describe it themselves, they know. It's, oh, well, I used to be able to sit and watch for a whole TV show, or I had a client recently that said, normally I could go to the grocery store and not bring a list and take care of everything right then and there. Very bright guy. I couldn't do that at any point in my life. But now he has to write a list and keep track of it almost step by step. So really it comes down to memory, concentration, callbacks, and really so many things that are just natural functions of the brain, like planning and organizing. All of those things are areas in which that we ask about when we're trying to figure out, has someone suffered a concussion?
Yeah, that totally makes sense. And I wonder if with the cognitive impairment that comes from a concussion, if this is where one might want to rely on a loved one to give them the feedback.
Oh, Absolutely. And it's
Mhm.
funny that you mentioned that. That's one of the most common things that we do in our brain injury cases is we speak to the loved ones, the children and the spouse, because so often the actual injury victim isn't as aware of the changes that they've
Right.
undergone. And I'll talk about this a lot more also when we talk about the emotional symptoms too, quite common there. But it's interesting because these changes are so subtle and take place in a way that many of us don't notice. Oh, I couldn't think of that word yesterday. And then over
Mhm.
time, we begin noticing more and more serious symptoms.
That makes total sense. Why don't we jump right into the emotional symptoms?
Absolutely. And the
Yeah.
emotional symptoms, it's hard to quantify as they are. I would say it seems like it happens in a very similar manner each time. People will talk about how, well, something that used to not upset me is upsetting me. And very often, again, people think, well, I just got in a car accident, I'm stressed. But what reality is one of the most hallmark signs of a brain injury of any kind, be it concussion or worse, is a change in emotion. In fact, this was one of the first interesting kind of asides. One of the first studies within brain damage came into effect when a gentleman had a rod go through his head, and he went from being the nicest guy you've ever met to kind of a grade A jerk after that. And everyone said, "Well, what happened?" And that's how it began the process of studying the physical ramifications of brain injuries. A lot of these also they can be more mood swings, going from happy to sad, more emotional. Isolation is kind of a big one that we talk about a lot here. All of a sudden, someone who used to be very social desires to be alone. Any change and any symptoms such as anger, irritability, things like that. Those are all the emotional symptoms that come up most often when we're dealing with brain injuries.
Okay. Okay. That makes sense. What about like depression and crying when you didn't used to cry or like any of those?
Absolutely. One of the things that science is beginning to flesh out, but we don't really have good results on this just yet. It's kind of a theory of mine that I've seen from quite a few clients. Individuals who have any kind of predisposition
Mm.
towards any type of mood disorder, be it depression, bipolar disorder, ADHD, those disorders tend to be accentuated almost tenfold following an accident like this,
Whoa.
especially depression. And I apologize. I don't mean to put such a serious number on that,
Yeah.
but it's a very serious change, and it's hard to quantify, as I've mentioned
Yeah.
before, because when it comes to emotions, it's very hard to describe. Well, before I may have been a little irritable, but now every small thing sets me off.
Sure.
But that's one of the most common phrases that I hear.
Wow. Yeah. Again, that would be something that maybe the person with the concussion wouldn't notice necessarily
Oh, absolutely
and
not.
rely on loved ones on that feedback as well. Mhm.
That right there with the cognitive are the two most common ones where, especially spouses of clients
Mhm.
that we represent, have spoken to us and said, he or she used to be a lot less upset than this. And at first I thought it was just the stress of the accident, but
Mhm.
now I don't know what to say. It's just they're different. They're more irritable. And it breaks my heart. And again, going back, so often these are short-term symptoms that resolve. But in a lot of the clients that we work with who have what's known as post-concussive syndrome, these
Mhm.
are some of the things that can linger for days, weeks, months, even years after the event.
Before we go on to the sleep symptoms, I want to ask you if anybody's listening to this and they're recognizing it and they're saying, oh, either I'm experiencing these or someone that I know or someone that I love is experiencing these. Do you happen to know this? I know you're not a doctor, nor do you play one on TV, but do you happen to know that the sooner that these are identified and treatment is sought after, then the better the recovery? Is that even connected, or am I just like,
Uh,
yeah?
that's an absolutely fantastic question.
Okay.
And no, I don't even play a doctor on Facebook live streams. So what I can tell you is that a doctor I've worked very closely with,
Okay.
um, Dr. Mathelson out of the University of California, Los Angeles. I guess UCLA is a better way to put that one. He tells people that the number one thing you can do from the moment you think you have a brain injury, the single best thing that you can do is sleep more. And you have
Ooh.
and unfortunately, as we stand here, people kind of want a solution to brain injury similar to the solution for, when you have a bacterial infection, you take antibiotics.
I was going to say, let's be honest, we all want to just take a quick, here, just give me a pill.
Absolutely. Yeah. Anyone who's got an injured shoulder, who may have more of an orthopedic injury, they know that oftentimes the path to recovery is a long one. And sometimes things aren't exactly the same as they were before. Some of the people that we work with are wonderful occupational therapists. We work with doctors' offices, neurologists, and a lot of neuropsychologists. And there's all sorts of different methods that can be done in order to rehab the brain. Unfortunately, there doesn't exist, like from that movie Limitless, there's no pill that you can take and all of a sudden the brain's back to normal or better than ever. But with little exercises like, working your working memory or sleeping more, these are all things that you can do to help rehab the brain. Or in serious cases, and I've had clients like this, I've had them work with occupational therapists who really help them cope with the serious injury that they've suffered. And while it is heartbreaking, it really helps people move forward with their life in the best way possible.
Awesome. Well, and coincidentally, the very next thing is sleep symptoms. We need more sleep, but we're having problems, evidently.
Absolutely. As you mentioned that, I said it's one of the great ironies there is, because so often that we see one of two things happen, and it's about 50-50 split between the two. I'm sure there's a more scientific breakdown than that, but I couldn't tell you when someone walks in, and especially cyclists that we would represent that have fallen on their bike and hit their head. Some will tell us that they are sleeping more than they ever slept before. And hey, I tell them that's great. Also avoid blue lights while you're doing it. And then some people say that they just cannot fall asleep, that whatever chemical it is, and I'm not a sleep expert in any kind, but whatever chemical it was that made them feel tired, they're not feeling that anymore. And both of these things I see. Now, the hard part is, especially when you have an accident victim, a lot of times there are other problems going on that are limiting their ability to sleep. And it's kind of getting to the bottom of that. And I always defer to the actual treating doctors when it comes to that situation. But it is kind of one of those cruel catch-22s when you have someone who needs to sleep more than ever before, but isn't able to fall asleep.
Yeah, no doubt. Well, the good news is you've given us a great overview of what to look for, whether it's us or whether it's someone that we care about. If people want more information, they can just go to this link that's at the bottom of the screen right now to get the Layman's Guide to Brain Injury. So it's bit.ly/TBI guide. And Joe, if people have maybe personal questions that they don't want to put on the comments or something, what's the best way for someone to reach you?
Absolutely. And I'm really glad you mentioned that, because I want everyone, whether you think you've suffered a brain injury or not, it's always best to learn about these, because a quick reaction is what's going to do the best for you.
Awesome.
But for anyone who is curious about this within their own life or as a friend or loved one, we have a symptoms checklist that we use, that we have every client of ours fill out. And even if they don't think they've suffered a brain injury, because as I mentioned, so often people come into our office with no idea that they've suffered a brain injury, and then they check 17 out of the boxes, and we go, oh my gosh, you've got a lot going on here. And if anybody wanted to get that or just speak to me on a more personal level, they can always reach me by email. My email is Joe, very simple, at jimdodsonlaw.com. Jim Dodson's who I work with, Florida bike guy. That's what got me into this area. I feel very blessed to be able to help people get the compensation, or really justice for injuries when they're caused by something that's completely not their fault.
Yeah. Awesome. So that's Joe at jimdodsonlaw.com.
Mm-hmm.
Perfect.
Absolutely. Awesome. Yeah. And you can also reach us if you can't spell, 727-446-0840.
Okay. I will put all of that in the description so people can just go click the link or copy and paste.
Thank you so much, Jenny.
Thanks, Joe. Thanks everyone for joining. Take care.
Everybody. Bye.